Oh, hello and welcome. I'm Sheila Balgobin, known as the Dream Decipherer, and this is Dream Your Life, Live Your Dream Live, where we look at all things connected to dreams. Today, we're going to be looking at medical intuitives or how dreams can be used in healing. It's an ancient art which has come forward into the modern world, and we're going to have a look at that and even look at how certain dreams can be indicative of certain types of illness. But to give a bit of a background, first of all, just to say that dreams have been used as a means of diagnosing illness since ancient times. And the work is carried on in the modern day through the work of medical intuitives who use dreams and their intuition to be able to pinpoint what's going on with people's health on a physical or emotional or psychological level. To look back in history, um, shamans, ancient Egyptians and Greeks, and other people, even today, use dreams as a means of being able to understand the nature of an illness and to find ways to heal it. But it's from ancient Greece that we took the modern tradition of medical intuition in which dreams play an important role. It was Hippocrates who used the analysis of patients' dreams to be able to find out what exactly was bothering them and derive practical advice about how to treat them. In the Asclepian temples, the dreams were inculcated or encouraged in patients to determine what the issue at hand was and what was needed to cure the issue. So I know from my own experience, I have used dreams with my counseling patients as well as other techniques, not to diagnose. I'm not medically trained, and therefore it would be illegal for me to diagnose anything, but certainly to highlight or pinpoint things that need to be perhaps followed up with a doctor or other medical practitioner or specialist. To give you an example, one client of mine who I was not working with dreams necessarily, but was giving a treatment to, I noticed that there was something seemed to be going on with her arm or shoulder that wasn't getting better even with several treatments from me. And I suggested that she follow that up with her doctor. And as it happens, there was a blood clot developing in her arm, and she would have actually lost her arm if they hadn't done something, given her medication or something to break up the clot before it became a problem. So it's use of not just dreams, but other techniques as well that give medical intuitives insight into what is happening with a person at a given moment in time. Sometimes these things appearing years before a physical symptom actually appears. So it's just like dreams can give us a heads up, if you will, with regard to incipient problems that, if they're not addressed, can become a problem. Now, there are several illnesses that can be indicated or pointed towards by dreams, and I'm going to look at several of those to give you an idea of how dreams can actually give us clues as to what is going on with us at some level, whether it be on the physical or energetic level. The first of these problems or issues would be anxiety and or depression. Now, if you're feeling anxious or depressed about something, chronic nightmares can be a feature that points towards psychological disorders. I mean, that's something that Freud and Jung showed quite clearly at the turn of the 20th century, that dreams were, as Freud said, the royal road to the unconscious. So what's hidden from us on a conscious level becomes apparent through our dreams. But chronic nightmares, according to a study published in the Journal of Clinical Medicine, are a feature of psychological or impending psychological disorders such as anxiety and depression. Another indicator that your dreams could be pointing towards is heart disease. There was a study published in a journal called Climateric back in 2003, which found that women who between the ages of 40 and 64 with irregular heartbeats and chest pains experienced more nightmares, particularly after menopause. Researchers believe that this may be due to the fact that there's reduced levels of oxygen going to the brain, and which can actually lead to nightmares. But the jury's still out. Not all the doctors agree with that, and there's very little data. Perhaps in future, more data will be, studies will be conducted to actually look at this issue a bit more closely and get some hard evidence. Another issue that could be flagged by dreams and can be picked up on by medical intuitives is alcohol dependency. Dreams can become particularly vivid after drinking heavily, and the reason why is because REM sleep is actually suppressed due to the alcohol. And being that REM sleep is generally when we dream, though we can dream in non-REM sleep as well, the body when the body has been metabolizing the alcohol, it will impact REM sleep. The brain actually becomes deprived of REM sleep. And this is something that's called REM rebound. And during this rebound episode, dreams become more intense, more vivid. So if, after heavy nights of drinking are causing symptoms where you're having nightmares or not getting restful sleep, it may very well be worthwhile looking at the levels of alcohol consumption to see if there's a problem there. Cancer is another illness that can be indicative or indicated through dreams. There's, again, limited doctors and limited data, and doctors aren't always in agreement about this, but there have been cases, anecdotal cases, where patients were diagnosed with cancer after experiencing upsetting dreams of some kind or other. Another issue that may be indicated through dreams is sleep apnea. Now, sleep apnea is when during sleep a person stops breathing for brief periods of time, which, again, starving the brain of oxygen, which can be a real issue. And it's not surprising that people who suffer with obstructive sleep apnea will often dream about suffocating or being unable to breathe. They literally are not breathing. There was a study done back in 2019 and published in the journal Frontiers in Neurology, which highlighted the relationship between obstructive sleep apnea, or OSA, and dreams. Some researchers found that patients who are suffering with OSA have dreams that are highly emotive in nature and particularly violent and hostile in nature, maybe because the body feels threatened, literally feels threatened by the lack of oxygen going to the brain. Now, while there are dreams that related to being unable to breathe or lack of being out of breath do take place in cases like this, most studies seem to indicate that this type of dream is actually less usual or less common than you might think. And finally, there is another disease, which is Parkinson's. Disturbances in REM sleep, particularly something that's called REM behavior disorder, may be indicative even years in advance that Parkinson's is something that's an issue to be looked at. Um, REM behavior disorder is defined as when the normal checks on our behavior, our physical behavior when we're sleeping and dreaming, becomes short-circuited. We suffer from or experience what's called sleep paralysis as a normal part of sleep, so that we don't act out what's going on in our dreams. Though occasionally there are breakthroughs and you might end up hitting your spouse or cursing out loud or whatever the case may be in your sleep. But generally, there's a natural block to movement, that to keep our limbs still while we're sleeping, so that we don't act out what we're dreaming. But these breakthroughs, if you will, of in REM sleep, these disturbances may be indicative of developing Parkinson's over the following 10 years that these dreams start. While there are medications and certainly alcohol, as I've stated earlier, that can cause these things, this behavior to happen as well. If neither of these are involved, there's no drinking involved, and there's no medication being taken, then it may very well be worthwhile checking into whether there is some neurological issue going on, which could lead to Parkinson's. So there you have it. That's just a brief glimpse of what can happen when we use our dreams to tap into what is going on with us on a physical or emotional or even spiritual level. It's an ancient art that's being used today by medical intuitives to look at our dreams and to know who we are and what we are experiencing. So I thank you so much for watching and listening. Have a great rest of the day and weekend, and I'll see you again soon. Take care. Bye-bye.